We all cough, clear our throats, things like that because we have secretions all the time. We're doing things like and clearing our throat, swallowing our saliva on a regular basis. And when ALS patients have those muscles in their respiratory system affected, they aren't able to do that as well or as often. A patient with excess secretions is not really having an excess of secretion. They're just having a problem maintaining the flow of that secretion. So you and I can swallow our secretions that we're producing all the time, whereas an ALS patient has a difficult time swallowing at the rate that they used to because those muscles are affected. Water especially thins those secretions and makes it much easier to move and get up. So that's one of the first things that we will always tell patients is remember to stay hydrated so that you're thinning those secretions. It's huge in the game of secretions, is keeping them as thin as possible. When they get thick, they're harder to get out of the throat and out of the lungs. There are typical medications. Many of them are prescribed by the physician, so they want to ask their doctor in the clinic if they're having excess secretions. But simple things like over-the-counter Mucinex, any kind of decongestants. A decongestant dries things up. So we will always recommend that as well. But keep in mind that drying up means drying up everything. So sometimes patients will complain of, I have dry eyes now, or my nose is dry, or things like that. So they may appreciate that anyhow because it's drying up the secretions in their mouth, but it's also drying up everything else too. So if they're having difficulty with the over-the-counter medications, then they may want to talk to their doctor about prescriptions. We start patients off a lot of times with a cough assist machine, and a cough assist is a machine that will help them do just that, assist with their coughing, especially if they have a lower ability to cough up excess secretions, things like that. However, I like to explain a cough assist to a patient like a treadmill for your diaphragm. So even if they are not having problems with excess secretions, they are able to use that every day to help exercise that diaphragm muscle so that they're getting the movement of the secretions in their lungs, whether they have excess secretions or not. It's a good machine to use every day just to help with that secretion movement. I would personally recommend doing a cough assist every day, twice a day, every day. Like I said, it's kind of that treadmill for your diaphragm. So we want to exercise our muscles every day. The cough assist should be used every day. Even if you don't have excess secretions, even if you're not having a problem coughing those secretions up, use it every day, twice a day, and that'll help keep your diaphragm good so that you have the best chances of breathing as long as possible. Suction, you really only need to use that if you can get those secretions up into the back of your throat, but you're having trouble actually like spitting it out. That's what that suction machine is for. And literally this suction is just like the wand at the dentist. It's not some scary machine to use where you're going down your throat or anything like that. It's just getting those secretions out of your mouth.